And good evening, everyone in Stockholm and in Nairobi. First off, to our friends in Stockholm, please pardon us. You know, in Africa we say Hakuna Matata. Hakuna Matata means there's no worries. You know, we just out to have fun, to live, and to enjoy the moment. But it's time for us to get back to the program, and it's my pleasure now to invite our penultimate keynote speaker. Allow me to read a little bit of her brief. She's the Executive Director of the International Society for Urban Health. She's a globally recognized urban health leader with over 15 years of experience advising governments, multilaterals, NGOs, and private sector companies, and practitioners to develop sustainable, inclusive, and resilient cities that promote and enhance resident health and well-being. Ladies and gentlemen, please help me welcome Giselle Sebag. Welcome.
Oh, now it's on. Great. Thank you so much, Eric. And thank you so much to IFLA President Bruno Marquez for inviting me, and to the entire IFLA World Congress team for organizing this amazing event. I'm really delighted to be here with you all in Nairobi and virtually for all of you Stockholm attendees. As Eric said, I'm Giselle Sebag, a trained architect, urban planner, and public health practitioner, committed to improving urban health by design. And as he mentioned, I have the pleasure of serving as the executive director of the International Society for Urban Health. For the past 20 years, the International Society for Urban Health has been the only global NGO dedicated to advancing our mission to work across disciplines and sectors to address the urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. ISUH, as we call ourselves, is especially interested in the ways that we can translate the vast evidence that's been gathered over the last 2 decades on the ways to build healthier neighborhoods and cities into action and impact for residents on the ground, regardless of their race or their background, their age, their income, or even their geography. Sorry, I actually didn't figure out how to go to the next slide. Next slide, please. Thank you so much. And I'm here today to talk with you all about what is critically important life-saving work. And that is work that all of you landscape architects and designers are doing every single day. Because the truth is that you might not know this, but you are all, everybody here today, everybody that is making an impact on the social or physical environments that we live in, you're all health professionals. And so then you are charged with either promoting improved mental, physical, and social health through your work in designing the landscape environments that we live, work, and play in, or, unfortunately, as sometimes it happens, hurting and perpetuating the existing systemic health inequalities that we have. So yes, I want you to feel that big responsibility that you have, but also to know that it's a choice. And I hope that from having this chat today together, that all of us built environment professionals, the architects, landscape architects, urban planners, engineers, all of us, will be able to really recognize the critically important role that we play in shaping health every day, and hopefully choose to consider to use that power for good, to benefit people. And so I'll talk just a little bit about the basics of the ways that our neighborhood environments impact our health, and some of the ways that landscape architecture and design specifically impact health, and summarize some of the really basic principles for us. And then I don't know if we'll have questions actually, because I have to tell you, I'll admit, my time was cut a little short today to keep on schedule, so I'll do my best. But if we have questions, maybe we can talk about it later. But I would like for you all to hopefully reflect a little bit on your own work. Okay, so up on the slide here, you can see this is sort of a reminder to think back about the multitude of ways that our social and physical environments make an impact on our health and well-being. So I like to think of these, I sort of keep it straight by thinking about it in 3 main buckets of determinants. So the first part is your genes, your genetics. And those are things that you're born with them, you can't really do much to change them. And then we have your environment. So that's the natural and the built and the social environment that we all spend time in. And then we have our behaviors. So those are the choices that we make about diet or exercise, smoking, drinking alcohol. And I have some really good news for everybody. The good news is that we have a lot of evidence on this now, and scientists now know that the leading drivers of death and disability, that's both in the United States but also globally, non-communicable diseases, so the things like heart disease or cancer, hypertension, diabetes, those are almost entirely determined by both your environment and your behavior. And your environment and your behavior are changeable. That's what I want you to take away. If you take away nothing else, remember that. So research actually shows us, as we have here up on the slide, that only 10% or less of your health is determined by your genetics alone, which means actually that the other 90% or more are linked to changeable factors in your environment. Because if you think about it, even your behavior actually is highly influenced by your environment. If somebody tells you that you should exercise more often or you should walk more in your everyday life, how could you possibly choose to do that if you don't have a sidewalk to walk on, just for example? And as designers, we really have a tremendous amount of influence over designing natural environments and built environments and facilitating social connections and activities that can support our health. So you really have the power to create environments, which makes something that I like to think about. How do you make the healthy choice the easy choice? By designing things like safe walking or cycling paths into your projects that we've been talking about here for the last couple of days, so that people have a choice to safely engage in physical activity. Next slide, please. And, oh, this is exciting. All right, our animation is working. It's a little small. But here's a slide to show a little bit about what researchers are saying about the ways that our environments impact individual diseases and health conditions. So they see really strong associations with things like air pollution or noise, excessive heat from things like heat island effect in cities that are exacerbated by climate change, from a sedentary lifestyle and a lack of sufficient green spaces and exposure to nature, among others. And then what this animation shows, even though it's small, is that each of these elements impacts all these different parts of our body in different ways, like our head, our arteries, our heart, our reproductive systems. And sometimes if we have these negative aspects in our environment, like a lot of air pollution, then it's more likely that we will develop some of those non-communicable diseases that I talked about before. Things like the cancer and the hypertension, or even cognitive impairment and dementia can be really impacted by a lack of natural or green space. So we could take that as an example, actually, that insufficient green space, we can look here and we can see that it's associated with increased stress and mental health conditions and with insufficient physical activity. For example, we can see here, it's associated with cognitive impairment or stroke or breast or colon cancer or hypertension and more. So just a little reminder of how these things also impact us as individuals as well. Next slide, please. And in terms of health inequalities, so often differences in neighborhood environments can explain big differences in life expectancies across cities. And we in the US, we call like the little block areas inside our neighborhoods, we have like zip codes. So we say zip codes, but in the neighborhood that you live in. And so the places that we live, work, play affect this really wide range of health risks and outcomes. And those determinants of health include neighborhood, physical environment, housing conditions, your occupation, your education, your economic stability. So I always think this is a really shocking thing, but it's pretty amazing when you think about it. Did you all know that the number one predictor of life expectancy, so how long you're expected to live at birth, the number one thing that predicts how long you're supposed to live is actually where you live, your neighborhood. So that's what we can see here. We are looking at place-based determinants of health, and this is small, but this is New York City, and we can see this across any major city in the entire world. I guarantee we have some of these same disparities in Nairobi, which is that if you are born in a neighborhood that does not support your health, you might be expected to live when you're born 20 years less than your neighbor down the street who has sufficient green space, who has opportunities to walk, who has a safe environment to live in. We can go to the next slide. Actually, I wanted to say one more thing about that. Can we go back? It cut out, and then I wasn't sure if we were done with it. Okay. So for example, We know, for example, and you all will know this as landscape architects because you're thinking about it all the time, that a lack of safe access to green space is actually one of those major inequities. And I don't know if anyone here follows, some major world newspapers, but the major American newspaper that I read often, the New York Times, this week actually has a front page article about the ways that free parks and green spaces in London are one of the very few great equalizers in terms of amenities in the city. Because all other aspects of life in the City of London, for example, are extremely expensive. And so green spaces are really cherished as an equity aspect for that reason. And then if we think back, I know we don't like to think about it, but if we think back to the COVID, the middle of the COVID pandemic and the beginning of it, it's probably not really a surprise that the neighborhoods that had the greatest COVID risk factors, like high numbers of household overcrowding or larger percentages of essential workers with higher risk to COVID exposure or poor air quality, that those also tended to have less public access to open space, to green space, to exposure to nature, which all really relieved the stress and anxiety and boosted the immune system during that really difficult time. Okay, now we can go to the next slide. Thanks. So one of the best ways for us to prevent these chronic diseases from affecting our neighborhoods is actually through upstream prevention. So that's meaning that we change the neighborhoods that are experiencing disproportionately poor health outcomes, and we can improve the neighborhoods with higher numbers of the neighborhoods that are suffering with higher numbers of people getting diabetes or heart disease or these non-communicable diseases, these chronic diseases that I was talking about. If we look at those neighborhoods in particular, we can actually improve those neighborhoods and transform them into areas that support health. Therefore, we can actually improve the equity in the city so that everybody born in any neighborhood in Nairobi could actually live to be the same, to have the same number of life years to expect. And that's what we would be aiming for. We want to make sure everybody, who's born in a city, everybody should have an equally health-supporting opportunity to have the best possible life, the best possible health, to live a vital life free of illness and disease. So actually, we know exactly what we need to do, and your design decisions that you all are making every single day in the work that you're doing has a real impact on those aspects of health. And improving life expectancy for all residents, it really can be accomplished upstream at a very low cost. So when you compare it, for example, to the return on investment in lives saved, or the years of life that you get added back on without being ill with something that is really, making you not productive or not feel good every day, or thinking about those extra years you get back by working hard, or reducing the hospital visits or the healthcare expenditures that you might have because you're sick. You can also increase tax revenue for cities and economic productivity. So there's a lot of benefit, and it's way cheaper if we actually prevent diseases from happening in the first place than treating them once somebody's already sick downstream. And you can really see then that the decisions that make the biggest impact on health are actually not always coming from doctors or surgeons or people who are trained in health. Next slide, please. In fact, the decisions that make arguably the biggest impacts on health are coming from non-health actors who are not necessarily trained to think about those connections that their design decisions, for example, make on health downstream. So the people like you all who design the places that we live in are in effect making all of you landscape architects and designers or any built environment professional, making you all health workers. So congratulations, welcome to the team. Next slide, please. So what are some of those key healthy landscape principles and how do they make an impact on health? Next slide, please. So we have a bunch here. We could talk about all of these and many, many more, but here's some of the key ones. So physical activity, traffic-related injuries and death, access and exposure to nature, social capital and interaction, and many more have these really profound impacts on health and well-being outcomes, as we were just discussing. Next slide, please. And so why don't we talk for a moment first about incorporating physical activity. So incorporating physical activity into everyday life is really one of the best ways that we have to improve multiple aspects of health through design. Insufficient physical activity or sedentary behavior is one of the largest killers on the planet today. I don't know if anyone's heard about sitting being the new smoking, but that's what the public health professionals are saying. Countless studies have shown that physical activity is really one of the best ways to prevent chronic diseases and conditions and to strengthen the immune system as well as our mental health. And it's one of the most important things that we can do to improve our health and reduce the those chronic diseases that I keep talking about. So here's a little photo just to illustrate that this is really important to public health professionals as well. This is from the US Surgeon General a couple of years ago, thought that focusing on improving walkability and connecting parks and recreational programming to sidewalks was important enough to make an entire campaign that he called the Step Up campaign. Because walking is a really easy way to start and maintain physical activity every day, to sort of have this physically active lifestyle. And if you have a walkable neighborhood, a walkable community, a walkable place to live in and to get to work or to get to school, it really makes it a lot easier for people of all ages and abilities to be active. And this is one of the ways that we, public health professionals call active transportation, those projects that make you get physical activity as you also get transported to another place. So you can really create active transportation options in your projects like biking and walking paths through your landscapes and incentivize physical activity while improving mental health outcomes and all these other wonderful things. Next slide, please. And an example of actually how poor design can affect children's daily physical activity is walking to and from school. So in the US, our Centers for Disease Control and Prevention, that's our main public health institute, a study that they did found that distance and traffic danger were the main reasons that parents did not want to let their kids walk to school. So when new schools are built a long distance from where families live, children are forced to be driven to school sometimes. And that really does deprive them of opportunities for physical activity, but also for socializing with other students along the way. Plus, it contributes to air pollution and a risk for automobile crashes, which we'll talk about in a moment, but it's pretty devastating. On the other hand, if we have safe routes to school, then people could be located closer to where they actually go to school. Maybe they could bike there, maybe they could walk there, and they can make physical activity part of their everyday life. And they can really establish those healthy habits that can last an entire lifetime. I studied or I've lived in many different places in the world, and I did think it was quite amazing. When I lived in Germany, I had a walk-bike route behind my house to my school that took me like 4 or 5 minutes through a trail through a forest, which was really nice. But it was by far the best school commute I ever had because walking through the trees every day really helped clear my head a little bit and improve focus for a day of learning to come. And that's what the studies show us, that in fact your cognitive learning abilities, your ability to remember things, your memory, so many things are improved by a little walk or seeing a little bit of nature on your way. Next slide, please. Here are some really nice girls walking to school here in Nairobi, and they're walking in this part, which is really great, but I noticed that it's not exactly the safest route for them, and they're not really exposed, at least here, to much nature on the way. So I know, we all have opportunities to do better, and I know even here in Nairobi, we have opportunities that we could create to support these girls on their walk to school. Next slide, please. Okay, so now I want to talk just a moment about traffic deaths, which is really unfortunate. But again, I think there's some good news here. Projects that make it easier and safer to walk or bike or to take public transportation, they reduce the number of cars on the road. And the combination of fewer cars on the road and how cars, bicycles, and pedestrians share spaces are all really important aspects of reducing traffic-related deaths and injuries. So there's some pretty shocking statistics here. They're small, it's a lot of numbers, so you might not feel the impact, but basically what we're looking at here, that's what we have written down in terms of data, are dying every single year, so more than 1 million people. And road traffic injuries are the leading cause of death for children and young adults aged 5 to 29 years globally. So that means that the number one reason that kids aged 5 and 29 across the world are dying is because of road traffic accidents. Motor vehicle crashes are a leading cause of death, both in the United States. US is just awful at road safety. Across Africa, unfortunately, across the entire region, it has one of the highest, or the highest, road traffic injury rate globally. But then also across Kenya, it's a top 5 leading cause of death. Roadways that are designed to slow down the speeds of moving vehicles and buffer bicyclists and pedestrians from road traffic really do reduce the probability of deaths and injuries from road traffic accidents. And in fact, I think we can see the statistic here, but it's small, so I'll tell you about it. In Kenya, car accidents are the number one reason boys between the age of 15 to 19 are dying. And those deaths, that's what I want to tell you all, those deaths are completely preventable. And we have Sweden here with us today, which is great, but I don't know if you all have heard much about Amsterdam being a very bicycle-friendly place, or maybe some of you have been there. And you might think to yourself, Nairobi is nothing like Amsterdam. There's nothing to learn there. and that we would never have in a place like Nairobi, or the place where I grew up in Atlanta, which is also super car dependent in the US, we would never have biking as the #1 mode share, the #1 most used option to get around. But in fact, I want to tell you a story. Until the 1970s, Amsterdam was actually extremely reliant on cars, just like here in Nairobi and just like in Atlanta. And in 1971, just to give you an example, 3,300 people in Amsterdam only, just the city, died prematurely because of car accidents, and 400 of those were children. So society at some point actually reached this breaking point, and the city's car reliance was seen as intolerable because of the high toll of child traffic deaths, just children dying from car accidents. So there's a really big activist group that got together from all different sectors of civil society and private sector and government, and they really turned Amsterdam into the cycling sort of utopia that it is today that we all look at. And we imagine that no one else could be like that. But I think the point here is that any city who's angry enough about children dying unnecessarily could also transform themselves. And that's something that Amsterdam did. Next slide, please. So communities where healthy foods are not accessible or affordable contribute to a lot of this chronic disease burden that I talked about. We have a big obesity epidemic in the United States, and obviously that continues to grow around the world, unfortunately. And healthy diet is really important, but it might be really difficult for some people because healthy food options are not readily available or easily accessible or even affordable. And in the US, we have this big problem where low-income and underserved communities often live in food deserts where there's not enough healthy food options, fresh fruits and vegetables, or they're not affordable, or food swamps where there are food options available, but they're really poor quality, and they really might have limited access to those stores that sell healthier foods. But sometimes they might have plenty of access to places that sell fast food or really unhealthy things. Or liquor, for example, or convenience stores where healthy food's less available and you might be able to only get chips or alcohol, something like that. So availability, I think, is less of an issue here, actually, where fresh fruits and vegetables, I've seen them all around. They're staples, they're found on the roadside, they're found really everywhere you go, in both wealthy and informal areas. However, what I have seen in doing a little bit of research is that affordability seems to be a cost here because of the rising costs of food, and that's a major challenge around the world, but certainly here as well. The point here is that good nutrition is really, really, really important to good health and to disease prevention. But it's really hard for people to eat their fruits and vegetables or to stay away from too much junk food if they don't have either access because of proximity, because they have to get in a car and drive to it and they might not have that car, or affordability if it's just too expensive to afford the healthier foods. So access to affordable and healthy food is really part of that healthy community design. The key tenets that you can think about when you're making design decisions, and a really excellent opportunity for landscape architects to create sustainable and low-maintenance food gardens, for example, or set up farm stands or other popular landscape elements that also promote at the same time healthy diet and nutrition. And in fact, one of the things about community gardens that a lot of people don't realize is that yes, it's an opportunity for healthy food access, but it's also a great opportunity for social interaction and physical activity. Next slide, please. Well, as natural and green space experts, I think everybody here is probably pretty well aware of the massive health benefits of spending time in nature, but I'll just remind you of what the scientists are saying. So the evidence is really clear that nature is one of the most effective medicines that we have for decreasing stress and anxiety or other mood disorders, and it has really important positive effects on cognitive development, attention capacity, and learning in adults. And then next slide, please. But it has even greater benefits for children. And so we can just look here and we can see so many important things, especially around learning and cognitive learning abilities. Next slide, please. So I'm getting low on my time, so I'll just go a little bit quickly, but I think some key concepts hopefully will still come out. So I don't know if you all are aware of this concept of social capital. So in the public health world, it's a sort of a defined and measured concept. And it's talking about the fabric of a community and the community pool of human resources that are available. And so it's thinking about individuals and the communal time and energy available for things like community improvement or social networking or civic engagement or recreation, personal recreation, or other activities that can create social bonds between individuals and groups. And such activities and bonds can have a really profound effect on mental and physical health. So scholars have observed recently a loss of social capital over the last decade, certainly in the Western world, but I think this is something that perhaps these Western ideas are getting to every place around the world globally, because we're a global society now. And some people have really attributed this decline to suburbanization and to sprawl and to spreading people out so that we can't even meet each other or don't know our neighbors, or we're behind these gates so we can't even talk to each other. So healthy neighborhood design, on the other hand, aims to really increase social capital by creating, parks and green spaces and other public places for leisure and social activities. This is in Barcelona, and they have a lot of great public spaces through the old city where cars don't go. And look at these nice people, dancing together. They might have not known each other, but this is an opportunity to meet. And then, we can also design for mixed uses, so both residential and different, commercial amenities, but also your healthcare, all these different uses. And I don't know if you've heard about this concept that, some people think it's like a control device, but I think it's pretty great, which is this 15-minute city idea, which is not a new concept. It's just a way to think about how you would ideally live in a place where you could easily reach within 15 minutes or less, biking and walking, all the different amenities that you would need for everyday life. And when you work closer to where you live, you're also reducing your commute time, and you're increasing your time for leisure and social activities, thus improving health. We know also, I'll just say, the more time you spend in a car, the worse your stress, the worse your anxiety. People get really angry spending time in cars alone. So wouldn't it be great if we had more time to socialize? Next slide. So one particular aspect of this sort of the social life concept is isolation and loneliness. So both have recently been declared public health epidemics, both in the US and by the World Health Organization recently. And one of the most effective ways that we have to encourage social interaction and decrease the isolation and loneliness that people are experiencing is to, as I just said, design spaces that encourage and celebrate a vibrant social life for all residents, regardless of their age or their gender or their socioeconomic status. We should all have places where we can come together and meet each other and know each other. And we have some really good evidence at this point that tells us how well-connected, compact communities with attractive and fun, just fun can be great. Public spaces can support a better social life. I have a mentor who also has been studying public life for decades and has documented a ton of this, and he firmly believes, and I tend to agree, that some ice cream doesn't hurt, and neither does a water element. Kids love the water elements, and everybody loves ice cream. Next slide, please. And then also, of course, I'm sure everybody's thinking a lot about this these days, but how we design our neighborhoods also determine how well we can cope with the climate change impacts that we're all feeling. Because car emissions account for, in the US, 26% of greenhouse gas emissions, and I did check this, and in Kenya, this figure is somewhere lower, to be expected, around 13%, but it's expected to continue to rise quite a lot every single year. But healthy landscape design elements could actually slow down the effects of climate change by providing alternatives to driving cars, like what we've been talking about, walking, biking, connecting to public transit. And as cities continue to grow larger and sprawling, they are experiencing stronger and longer heat waves because of urban heat island effect, which I have a slide later, although I don't know if we'll get to it. But basically, there's two main factors that create urban heat island effect, and one is not having enough trees or vegetative cover to cool the cities, and then also the construction of dark surfaces that absorb the heat and then re-radiate it later on. And that's the concept, of course, that you're probably familiar with, where the city itself is much hotter, can be up to 10 degrees, well, that's Fahrenheit, up to, I think, 8 to 10 degrees Celsius as well in a new study that just came out, hotter in the city than outside the city because of that lack of green space and vegetation. So landscape design elements could really lessen the urban heat island effect if we are creating things like more parks or green rooftops or gardens or green trails or nature preserves. That really helps. Next slide, please. So all of these healthy environmental design principles, they can make our communities healthier, they can make them more attractive, they can make them more affordable. Next slide, please. And when a community does implement some of these healthy neighborhood design principles, then the health co-benefits of those aspects are countless. So when we are improving sustainability, we're also improving health and lives. Next slide, please. Here's a very sciencey slide. This is from my friend Mark Neuenhausen at the IS Global in Barcelona. They're experts at looking at the environment and understanding the health impacts. And this is just a model of the environmental disease pathways that, just so you're sort of aware of what they are. There's many things that we can change, and here's how they affect some of those health outcomes. Next slide, please. And at ISUH, we've been focused a lot recently on combating climate inequity with sustainable design and development practice. And I don't really have time to go through this, so I'm just going to ask to go to next slide. Next slide. Next slide. Can you go one more? Yeah, one more. So I'm not going to explain this Accelerating City Equity Project. Anyone who was at the event before, one of my colleagues did present it. Let's keep going. I just want to get to one more thing at the end. Next slide. Keep going. I'll tell you when to stop. Okay, heat island, we talked about this a little bit. Here's some more of the health effects. Next slide, please. And then this I did want to talk about for a very quick moment. So this is about air pollution. So globally, air pollution is a leading killer still, which it's actually responsible for more than 4 million premature deaths from outdoor pollution and almost 4 million from indoor pollution every single year. And amazingly, 91%, so almost everywhere, of the world's population breathe air that exceeds what WHO says are safe levels to breathe. Air pollution has really significant negative impacts on development, on early childhood development, brain development, learning, and I even have some examples on working memory at school from, pre-birth to, prenatal, all the way into early childhood and into your lifetimes. Okay, next slide, please. We've talked a little bit about this. Green space is very good for health. Next slide. We'll skip this. Keep going. I'll tell you when to stop. Okay, we have to go through very, very, very till the end because I'm out of time. In my defense, I thought I had more time. Okay, stop. Okay. Here's what I want us to think about. I want us to just turn within yourselves and ask yourselves, moving forward, you are now you've been anointed a health worker as well. So maybe you can just keep some of these concepts in mind as you're making your design decisions. So are you considering the health impacts of your design decisions? And do they offer some of those healthy community design benefits, especially to young children and caregivers and seniors? And are you making healthy choices, the easy choice for all community members, for everybody who lives, works, plays, or learns nearby one of the sites that you're working on? Next slide. And I hope that in the future, you'll continue to think about this, and maybe you can commit to doing something today and to moving forward to actually impact health through the work that you do. And next slide, please. Thank you so much. I really appreciate it and hope to stay in touch.